There have now been confirmed cases of Ebola here in the United States. 2 of them contracted in the U.S. All are in Dallas.
While all 3 are associated with the same patient, this is all happening just a few hours from our front doors here in Houston. Isiah Carey takes an in-depth look at the issue in tonight's Factor Uncensored. Isiah?
Well, guys, if you ask me, I don't think Dallas was ready at all, and I'm not sure this country is ready at all for the devastation we know as Ebola. We as Americans sat by quietly earlier this year as hundreds of people dropped like flies in Africa. What we forgot, there are no longer oceans that divide us. We are now a global community, a global society where people travel from one continent to another by plane. Do you still want to be that international city in Houston? Then prepare for it. We must come to the realization that what happens in Africa or Asia will affect us right here in the United States. So you can no longer point and say it's a problem of those people. We all have a vested stake in this deadly game, and Ebola doesn't play favorites. Ebola first appeared in Zaire back in 1976, wreaking havoc and killing 88% of the people infected by the deadly virus. There were also 284 cases in South Sudan that same year. Ebola becomes synonymous with death.
For any hospital anywhere in the country that has a confirmed case of Ebola, we will put a team on the ground within hours.
Ebola eventually fell out of the headlines until a major outbreak in Liberia, Guinea, and Sierra Leone this year. Thousands of people have been infected so far, with a death rate of 52%, according to the Centers for Disease Control.
We have the public health infrastructure and systems and support that make an epidemic here highly unlikely.
In July, 2 Americans are infected while helping patients in Liberia, and both are sent back to America. Both survive after getting an experimental drug called ZMapp. By September 2014, Thomas Eric Duncan arrives in Dallas from Liberia and becomes the first person to be diagnosed in America with Ebola. This is while an NBC cameraman is also infected and flown back to the States. But by October, Thomas Eric Duncan dies, and since that time, 2 healthcare workers who had contact with the Liberian national have tested positive for Ebola in Dallas. People for the first time in history infected with a deadly disease in America and in our backyard. Even after all that, some in Washington, D.C. are still delusional.
The way that Ebola is transmitted is very clear and is something that is not likely to happen in the United States.
News alert to D.C. That ship has already sailed. Joining us live for the Factor Uncensored, Dr. Catherine Troisi, Ph.D. and Associate Professor at UT Health School of Public Health. Also on the panel to discuss this issue is Dr. Brian R&R, Director of Disease Control and Clinical Prevention at the Harris County Public Health Department. We want to thank both of you for joining us this evening. First of all, please tell me they know what they're doing in D.C. and they know what they're doing in Dallas. Start with you, Dr. R&R.
Yes, yes, and here.
Okay.
Throughout the country.
We've seen some mistakes, though, and there have been some admissions of mistakes throughout this investigation from the moment Mr. Duncan arrived in this country from Liberia. How do we explain that?
Well, first of all, let's remember the Ebola virus is not new. We've learned about it, its science, its modes of transmission, for almost 40 years. There have been over a dozen outbreaks in Africa in the recent decades, and the most recent outbreak over the last several months has resulted in more deaths than all of those outbreaks combined. Because of the large number in that outbreak, the disease has now migrated to Europe and to the US. It's new for us in the US healthcare system to be dealing with it. And because of that, we have somewhat of a dynamic and unfolding understanding of how we operationalize our practices. But we've spent tremendous effort in this community and throughout the medical community in many cities, in all US cities, to be prepared for the occurrence. But it's important to remember, you can only get the disease Ebola by direct contact with the blood or bodily fluid of a patient who is already sick with Ebola. Dr. Troisi, in the community.
Gotcha. Dr. Troisi, you know there are a lot of people who are paranoid out there saying that now it could be airborne. How do you address that and give them calm and say it's not airborne, it's only through bodily fluids?
There is no evidence at all that it is airborne. If it were, we'd be seeing a much different epidemic. We have never known a pathogen, any virus or bacteria, to change its mode of transmission, to go from being in bodily fluids to airborne. So that's just not a concern.
So the public should be reassured that this is not a major issue when it comes to being airborne or any other problems.
Yes.
So it's also important to understand that a virus such as the Ebola virus does not persist for long periods of time outside of a living organism. We want to understand the ecology of how the virus has caused outbreaks in Africa. But the situation, the ecology, if you will, of the virus here in the US, with different medical care, different public health care, early isolation of the few numbers of patients, an excellent contact investigation of anyone who might have been a contact is going to result in a very different scenario unfolding.
Dr. Aradar and Dr. Troy Isiah will continue with this. We want to thank you guys for coming on live with us. Melinda, back to you.
Isaiah, thank you. Our conversation about Ebola continues after the news. Join Isaiah and his guest on your computer or tablet at 6 o'clock on myfoxhoustonlive.com.